Hello, good day viewers. Welcome to another episode of NIMASA podcast. I am your host, Chukwuma Moghalu. Today's topic is very special and very important to me and you. The Maritime Connection, Navigating Oral Health with NIMASA, an expert's guide to maintaining a superior oral health. Before we start, we dedicate this episode to everyone who loves a better oral health, to those who would love to increase their smile, and of course, have a better laugh. Live with us in the NIMASA podcast studio today is a fine young gentleman who I crossed paths with by virtue of a toothache earlier in the year. This young man was indeed very happy to see me. He carried out his duty very diligently and, in fact, kept following up to know how I was feeling subsequently. Join me as I welcome nobody else but Dr. Daniel Iweka. Dr. Daniel is a skilled dental surgeon with over 3 years' experience in general dentistry. You're welcome, Doctor.
Thank you so much, Mr. Moghalu. It's a pleasure to be here. Good day, everybody.
Thank you for honoring our invitation. As we keep the ball rolling, it's worthy to note that according to the World Health Organization, the WHO Global Oral Health Status Report of 2022, oral diseases affect 3.5 billion people worldwide.
Oh, I like that statistic of the WHO. Permit me to come in
Yes,
there.
please, go ahead, sir.
And also add that 2024, our World Oral Health Day, which happened in March, the theme was "A healthy mouth is a healthy body." And what that generally states is that there is
A connection.
Right? As we've already said, maritime connection. So it's a connection between oral health and your overall well-being, and one cannot do.
Interesting,
without the
Doctor.
other.
We'll get to that. There's a lot to discuss today.
All right. Yes,
But
it is.
let's start by allowing you to briefly introduce yourself and tell us what your role is at NIMASA, Nigerian Maritime Administration and Safety Agency.
All right, great. Like I've previously said, or like you have introduced me, my name is Dr. Daniel Iweka, and my role at NIMASA, the Health Services Unit, Dental Unit, was according to the oath that Hippocrates made us to swear.
I hope you're not casting the oath, though.
Oh, no. The oath is pretty long,
Okay,
right?
okay.
But I'm tasked with the responsibility of your oral health. I'm tasked with the responsibility of making sure that you have superior oral health, making sure that your oral well-being is the best it can be. And for me personally, I'm an advocate of painless dentistry. I believe that when patients come in, they should leave happier. So I put a smile on your face.
Oh, nice. I like that because initially I said this podcast is dedicated to those who want to increase their smile and have a better laugh.
And I believe that should be everybody.
Everybody should wish for that.
Yes.
You can't ask for anything better.
Exactly.
All right, so let's look at the path, the journey. What inspired you to pursue a path, to pursue a career in dentistry?
All right, so pursuing a path in dentistry, initially, and I state this with no regrets,
Yeah.
right? Initially, I wanted to study medicine and surgery, but then I was asking questions
All right.
during time of deciding what career I'm going to
Venture into.
invest in or venture into. And I have a senior sister that studied medicine and surgery, and I asked her, questions about it and all that, about different routes and all. And then she made mention of dentistry. I was like, oh, okay, what's that? And then she was like, oh, this is what they do. She was already in school. She was almost in her final year, medical school. And it just felt like the road less traveled. And one thing about the road less traveled is that they are interesting adventures, they're interesting things.
New parts.
Yes, new parts. And I like charting those territories. So, okay.
It sounds
Okay,
like you're
we're
a
going
very,
to-
very adventurous person.
Oh, yes, why not, you know.
Interesting. So now we're looking at oral health review. How would you best define oral health? What is the importance of oral health to our overall well-being?
So,
Because initially you mentioned the fact that there's a connection
Of
between
course.
oral health and our whole body, ourself as a whole.
Of course.
So now define oral health for our viewers, and also let us know what the importance is of the overall well-being in connection to oral health.
all right, so oral health basically talks about the general outlook of the teeth, the gums, the tongue, the oral cavity itself. So it borders on the state, right? The medical well-being, the medical state of
Okay.
those tissues in the mouth,
Okay.
right? So when we're talking about oral health, it envelopes all this, right? So we'll talk more about this further way down the line, but that's a brief overview,
Okay.
right? I wouldn't want to make
So,
it
so oral health is more or less, I would say, the state of your mouth,
exactly
your teeth,
the state
your
of your
oral
mouth, the
cavity,
teeth,
and
the gums,
your gums, and
oral,
all of that.
Yes,
And
exactly.
So,
all
basically,
the components, all the components of the oral cavity.
So our oral hygiene, in other
Exactly,
words.
yes.
All right. So, there's the oral anatomy. Tell us
Yeah.
about it.
Okay, so oral anatomy, I'll try to be as concise as possible.
Yes,
not
and
to bore you
and
with-
the layman's
with-
language, so that
not to bore
our
you
viewers
with a lot of medical
Terminologies.
terms, because the essence is passing across a message
message.
that is fully understood,
Understood.
even
Perfect.
to the
To the-
layman,
to
the
the-
man,
yeah, exactly.
just by the street or the roadside.
Yeah.
So, oral anatomy. I will classify it into two.
Okay.
Right, we have the hard tissues of the mouth and we have the soft tissues of the mouth.
Okay.
So the hard tissues of the mouth, basically the teeth, right? And then the soft tissue is every other thing, the gums, the tongue, the cheeks, right? The palate, So that's the general overview, the general classification. Whereby
Components.
you can now decide that, okay, this is what makes up the
The
oral
anatomy.
anatomy.
Yeah.
Right. We have the soft tissues, we have the hard tissues.
Okay.
Hard tissues are the teeth, right? And then also, for the teeth in number, you have for someone, a child, right? Child have primary teeth,
Yeah.
which is different from an adult that has the permanent teeth, right? An adolescent has the mixed dentition, right? And then you also have like the soft tissues I've mentioned previously, the tongue, the cheeks, the palate, yeah.
Okay. So you've been able to tell us what the oral anatomy is.
Yeah.
So we know this consists of basically our teeth, our tongue, the palate, and all of that.
Yes.
So coming down, right? Let's look at the risk factors, the common issues, as regard to our oral anatomy. What are these things that
As regarding
factors
our
that
oral health.
that leads to poor oral health? Let's look at the factors that lead to poor oral health. What can lead to a poor oral health as an individual?
All right. So, thank you for that question. Very nice question.
Thank you.
So, talking about the risk factors, these are the things that we do knowingly or unknowingly that contribute to a bad oral health, and there are numerous things, right? Behavioral things, example, maybe we're talking about not using the right things to brush, using your teeth to, let's just say, maybe like to break down or break or chew
Hard.
huge pieces of bone. You know, I have some patients come to me and say, oh, doc, I can't do without chewing the bone, because if I don't chew the bone, that's the sweetest part.
The calcium.
You know, that's the sweetest part. And I try to let them know that no, calcium comes from different sources. You don't have to grind down and all that. So excessive occlusal force, excessive. Oh, I said not to use.
Yeah, but that's we'll still break it down for those that don't understand.
So, so excessive force, use of occlusal force, grinds down the teeth, and then bad practices, use of toothpicks,
Floss?
Floss is good.
Floss is good. Okay.
Floss is good. I always use there's an analogy I always use,
okay.
And that analogy, I always say, try to imagine a woodpecker, and a woodpecker has wood, and then it continues to hit that wood. Over time, the wood gives way.
Yeah.
No matter how hard that wood is.
Correct.
So it's that same mechanism.
Consistency.
Exactly. It's that same mechanism that happens when you use toothpicks to pick out things in between your teeth, right? Then imagine also someone using a hard toothbrush. They're not using the right things to clean, right? And then basically not being aware or not being well informed of how often you should come in for a checkup and all that. So these are, these risks, these are the factors that can contribute to having a bad oral
poor oral health.
Yes.
What about imbalanced diets, poor food, free sugars and all of that?
Yes, imbalanced diets, like you said, imbalanced diets. That means that there's a tendency to shift towards one side instead of trying to balance it up and then making sure that everything is in harmony.
So talking about keeping the oral health clean, what are the signs? When before any of this eocide comes up, there's always a sign. So what are the signs of a poor oral health? What do we notice? Okay. What should we look out for?
Yes. Now we're getting to the meat of.
So we're about to dissect it.
Dish. Exactly. So signs of poor oral health. We are talking about. Let's just talk about the one that is that you can always see.
Exactly.
Right. So when someone has stains, right? The person has, the teeth. The person has pains, right? So, like I said before, the first thing I said, stains, right? So the mouth is dirty but visible. You can see it. You can see plaque. You can see dirt around the teeth. It shows that there's something that's not being done right, right? Discolorations. So aside from discolorations, then another sign is pain. This is the one that usually brings patients to the clinic.
When the pain starts.
Exactly. When the pain starts, it's dental pain. If it's not the worst, it's among the 3 top most severe
oral health
kind of pain that someone can feel.
Are you speaking within our demographic area or generally?
Like generally.
Okay. Okay.
Generally, this is important to note. Some people say, that labor pain is, and then you have some women that will tell you, wow, labor pain, yes, but dental pain. Have you experienced toothache before? Right? Have you experienced toothache?
Yeah.
If you've not experienced toothache, then
just leave it.
You've not gotten there.
Just leave it.
Right. So, like I said, so those things are. Then there are also other signs, caries, basically what people refer to as dental holes, right? So bad breath. This can really tamper with someone's confidence.
Yes.
Can really tamper with your confidence, right? So, and then some people have like cheap tooth. Maybe they had maybe a specific tooth is discolored or chipped, right? So yes, these are signs when you say, okay.
This is
need
now
to-
we linking it to the overall well-being of an individual, because
Exactly.
when something starts to mess with your confidence,
Exactly.
then it probably keeps you away from socializing.
Exactly.
And you try to recline yourself from
Exactly.
coming out to meet
Exactly.
people and all of that.
Yes.
So, what are the impacts on our overall health? They say the human body is connected, right? Like I said earlier on, the human body is very much connected. And in light to this, how can we've discussed about the self-confidence and all of that. Somebody said something to me one time, and they're like, the mouth is the biggest hole in your body in which anything can go into the body. All right, the mouth feeds the body. So in the light of that, right, how can a problem with that passage, which is the entry to your body, affect the overall body?
All right. That's a very, very good. That's a very, very good question. Right. Like you said, the mouth is the biggest opening, right? That you can voluntarily open, the biggest opening, and anything that we take comes in through the mouth. So that means that there's also, when someone is ill, you take drugs through the mouth,
Exactly.
right? And then the person gets better. Right, so there's a systemic component of that. There's a systemic component. There's a systemic linkage. The mouth is the gateway to the
gateway.
body. So that means that there are a lot of signs that one can see during examination. A patient comes in, I check the mouth of the person, and then the mouth can tell me
some other things that you didn't even
other things that the
anticipate.
person didn't even know they might have.
Yes,
Right?
very correct.
For instance, I'll give you a systemic disease, diabetes. Now, diabetes, when a patient comes to the clinic, there can be some signs. When person opens up for examination, there can be some signs that will point towards that. That would stir me to ask some questions. When asked, did you check your blood sugar?
Yeah.
Are you diabetic or not? Right? So these are
some irregularities
exactly
within
these
that
irregularities. They can be endocrine. I've already mentioned diabetes. They can be hematological, maybe leukemia. That's like an issue with the white blood cells, right? So infections that could just show, as you can see, different things that would point to a systemic problem. So that's why we don't joke with the oral health. We advocate for making sure that your oral health is superior.
and should be cared for. So to the viewers, we're not about to scare you with all the terms and all the things that could possibly arise from a bad oral health or from oral health problems. So we'll be discussing the preventions and the things we can do to ensure our oral health is at its peak, or in situations whereby people already experience problems or these issues, how to overcome it and how to do better in caring for our oral health. That's you having a proper oral health hygiene. What are the effective ways to prevent oral health problems and maintain good hygiene?
Right, effective ways of preventing oral health problems and maintaining good oral hygiene. Main points I'm going to address is brushing. Everybody always says, "Oh, brush. I brush."
How many times are you required to brush in a day?
I was about to ask you that question, but you beat me to it. So
you should answer it. You're the doctor,
right,
so you tell us.
Right. Okay, so ideally you're meant to brush twice a day.
Okay.
In the morning.
Okay.
And last thing before you go to bed at night. Right. So that means that if you're home, maybe you had like a very stressful day, and then maybe your friend or someone you've brushed, but then your friend or someone has bought you suya. And then
you just have to consume it.
And you have to consume it because it's best consumed hot.
Yeah, very hot.
Or fresh. And then you go back and then you eat it, that means that on that day, you're going to brush 3 times.
3 times.
Because you're meant to brush in the morning and at night before you go to bed.
Yes, after every meal.
Now, that's just one aspect of brushing. The main aspect or other aspects include what you're going to use to brush. It's meant to be a medium texture toothbrush.
Okay.
And then there are other aids, right? We spoke about one of the signs of poor health or poor oral hygiene being bad breath.
Yeah.
Most times it's also because people don't know how to clean their tongues or forget to brush their tongues properly. There's
So
also
the tongue scraper and all of
something
that.
known as the tongue scraper that could help with cleaning the tongue better, because sometimes when some people put in their brush to the back of the tongue, they might have like a gag reflex, right? The tongue scraper is smaller.
Yeah.
It helps to get to those parts that you might have a gag reflex if you're using your toothbrush. Right? So, and then what are you meant to use to brush? You're meant to use a toothpaste with fluoride. People miss this.
How much fluoride?
Now,
because I know that's a problem. I read somewhere.
It's usually negligible. Most times when it says there is a recommended
dose.
Yes. But then the toothpaste companies take care of that.
Okay, because according to study, just in the United States alone, right, there are states that are suing the government because there's a norm in some states where the drinking water, right, is already mixed with a little bit of fluoride.
And that's why I'm also saying that for us, our demographic, Nigerians in Nigeria, you have to make sure.
So you're coming back home.
Yes, Nigerians in Nigeria, you have to make sure that your toothpaste has fluoride. Now, all the various fluoride or all the various toothpaste companies won't put, that this is, you have 0.000 this of fluoride. But then you would see in the ingredients when you're looking at it, fluoride present, this, that. But when you check and you see that there is no fluoride there, I would advise you to not pick that toothpaste, right?
So you're listening. Hope you're listening.
So
don't buy a toothpaste without fluoride.
Exactly, because fluoride helps to remineralize your dentin, your enamel, helps to remineralize your enamel, right? So it's an important component for us, and we get it from the toothpaste.
Okay.
In the US, you mentioned, in the US they have other sources. They have other sources of fluoride, and in the water.
Yeah, the drinking water.
That, yes.
But I was about to mention something. There was an issue at a point. Some states were suing the government for having excess fluoride in the water, and some states were also suing the government for not even having fluoride at all in the water.
See, so exactly. So because of this, in more developed climes, they have other sources of fluoride, so they don't need to necessarily have fluoride in their toothpaste.
Okay.
But for we back here at home, I would encourage everybody, make sure that when you're getting your toothpaste, there's fluoride.
Okay.
So now we've talked about the things that you use to brush.
Can I ask a question? Let's try and break one myth.
Okay.
There's a myth of fluoride, right, or excessive fluoride in quote could erode the enamel.
Okay, so it's not eroding the enamel per se, but it would elicit some signs. Excessive fluoride would elicit some signs in the enamel, and that's called fluorosis, right? And it can come in various forms.
Because when you mentioned remineralize, right?
Yes.
I know there's something that's demineralize as well.
Yes.
So remi and demi.
Yes.
Okay,
so
that's why I asked that question.
Yes, exactly. So most times you could now see that there are some signs, there's some whitish speckles on the surface of the enamel or on the surface of the teeth. It could be anything, but then when we ask some more questions, we could now determine if it's actually a case of too much fluoride, and then we address it as
it should.
Fit.
Yeah. As it should.
Yeah.
All right. Good to hear that.
So we're still talking about, aside from just having the necessary items needed to brush, which I've already explained, what's also important as having the right necessary items
Items, yeah.
is the technique. Now, it would interest you to know that
I wish we had a
I was
toothbrush here so that you can actually show us how to do it.
Right. That would have been
Been
a
ideal.
good one. That would have been a good
We'll
one.
probably have to have a part 2 of this discussion.
Well,
We would love to have you again. Okay.
yeah, so when you're having a toothbrush, there is the correct technique that's used to make sure that all the stains, or let's say all the debris, is cleared off as efficiently as possible. Right? So when I was in nursery school or when I was in primary school, what they taught me on how to brush was not
I remember
the same
up,
way
down,
that they taught
up
me,
to down,
and it was
or-
not the same way that they taught me in secondary school. And then when I now got to
It's a professional path.
yes, when I got to the university, in dental school, and then I learned about, oh wow, this is actually the proper way. This is what we should be.
So which is the proper way?
Exactly. So the proper way is actually, it's like a modified method.
Circle.
So yes, it's a circular motion and away from the gums. So it's not just up down, up down, up down, up down, up down. Because you have to make sure that the bristles get in between the gums and the teeth. Make sure that the bristles get in there and then take away any
Good
stains
job.
that you have and all that. So it's a circular motion. Circular motion and away from the gums. So for the upper teeth, circular motion away, you swipe downwards. For the lower teeth, circular motion, you swipe upwards and then you spit out. Make sure that the person doesn't forget the inside, because most people forget the inside. And then when they come in, we see that, oh, the inside is looking much more dirtier than the outside.
yeah.
Right? And then the occlusal surface, the surface that's used to chew, and then the tongue, right? Ideally, you should use about 2 minutes to brush, right? So make sure that, so if you divide it into 4 quadrants, so that's about more or less like 30 seconds.
And so
Give or take.
it's not about how long.
It's about how well.
It's about how well you do it.
And then it's not about how much force. It's about the technique. Because some people will be brushing as if they are going to fight
You
war.
said it's not the
somewhere.
force you use that will whiten the teeth.
It's not that will keep the teeth clean.
Yeah. I like that. Keep the teeth clean.
Yeah.
Now let me ask a question on behalf. I know this will be on so many people's mind, right? When you talked about the second, or let me use the word, the last brushing after meal, right? After the last meal, after that hot fresh suya. Can mouthwash replace that?
No. Mouthwash cannot replace brushing. Mouthwash is an adjunct. It's supposed to, you can use after, but not in place of.
Okay.
You
So
can-
after that last hot suya, after we've brushed the second brushing of the day, and we're tempted with that last suya, and we decide, okay, after that
brush
suya,
again.
we'll brush again.
Brush again before
so you
you
heard
use
that,
the mouthwash.
you brush again.
Yes.
The mouthwash should be an add-on.
Yes.
And should not replace the brushing. How often should we have a dental visit? How often should we come to the dentist to check what is wrong or to get an update on our tooth, on our mouth, on our oral care? And while you're speaking about that, please also speak about when we come, what are the procedures expected?
Okay, great. So, you're supposed to come to the dentist once every 6 months. So that means in a year, at least twice. Now, through the year, everybody has goals, everybody has work, everybody has family, everybody has a lot of things that we are doing. So most times I just tell patients, especially those that have kids, you can target just before, or maybe just before they resume.
Yeah.
Right? Because they resume maybe August, September, I think.
Yeah.
Right?
Summer.
Or July. July, yes, summer. So July-ish, they start planning for resumption. So bring them to the clinic, and then you use the opportunity to also get checked out, right? And then just before they resume in January as well, after the Christmas break and holidays.
Yeah, after the
right?
enjoyment.
Exactly, after the enjoyment, whatever the enjoyment may
The
be.
unlimited choppings.
Unlimited choppings
You
and
come back to
doings.
check, yeah.
And doings, yeah.
It's very necessary.
So just before that, you come back again, and then you check, and then you check with them, So that helps to seamlessly put you in the way of doing the right thing as regards your oral health and oral hygiene. When you come to the dental clinic, right, you'll be asked some questions. If you have any concerns, if you have any pain, if you have anything, that's when you tell the dentist what the issues are. The dentist examines. The dentist asks, so he might need some extra things to help with diagnosis, maybe like an x-ray or whatever he needs, and then aside from that, he lets you know, once that has been taken, he lets you know, oh, these are the things I found, these are the things we are going to do to get you to a place of superior oral health, right? And it's also very important to state or to just bring to light that a stitch in time really saves nine.
It's never
as
too
regards
late.
dental treatment.
Yeah, it's never too late.
As regards dental treatment. And this is also the maritime sector. You can imagine you have seafarers, you have people who go offshore for a long time, months on end. They are not around, right? So if you can just think about if they have, what happens if they have issues, right, as regards, dental health. So it's very important to note that you have to take care. Preventive management is the best management, right?
Keep away the disease for long.
Preventive. You make sure that you're doing the things that would prevent the formation of more dental issues, so that while you're away on sea, you can enjoy your time out offshore without dental problems. Yes, so
okay. So let's bring it back home. Let's take it up and personal. You've been with us for some time right now at NIMASA. Could you just briefly share to us a memorable experience, an insight you've had, during your time? Just highlight, and while you're giving this insight of your experience here in NIMASA, also highlight the importance, like you've already stated, on prevention and why we should prevent all of this, rather than giving examples of seafarers that are onshore for a long time and have no access to any of this while they're on board vessels, and reasons why they should prevent this prior to getting on board vessels. So give us one of your memorable experiences while serving at NIMASA, and along the line highlight the importance of why we should maintain this oral health care hygiene while we wrap up.
All right, thank you. It has been a memorable experience at NIMASA, providing dental care for patients and staff. And like I said before, a stitch in time saves nine, because dental treatment, it's not cheap, right? It's not cheap, and the longer these issues, or the deeper these issues become, the deeper the pockets go, right? And it's also the deeper the pain. So it's also very important to note that, or to state that, the agency NIMASA has done such a good job with the health services, making sure that this is accessible
to everybody.
Right, it's accessible to everybody. Exactly. So, at the clinic, there's a dental unit, and I have seen in my time that people take advantage of this. They know that
it's a benefit. You must enjoy your benefit.
Exactly, it's a benefit. So the more you are aware, especially people who are aware, as people who have had dental issues, dental pain before,
and I've gotten involved,
and they have gotten involved, so they know what it takes, right?
Yeah.
And we have made sure that we uphold good standard of practice. Make sure that, like I said before, I'm an advocate of painless dentistry. I want you to leave smiling. You can come in crying. That's okay. But then I want you to always leave smiling. And then we also try to make sure that we check up on the progress. We have to review. We have to make sure that that you are doing okay.
Okay, follow up.
Exactly.
Very key.
So part of my memorable experiences, changing smiles. I let's just say, I create smiles for that's my job.
We told them initially that you want to improve your smile and have a better laugh, then you need to watch this episode.
So that means that, it's a thing of joy when maybe someone has a cheap tooth, there was a patient, a staff that came in, and then there were issues and all that. And by the time we were done, she was so happy, she was overjoyed, basically, and experiences like that, warm.
It's fulfilling for you.
Exactly, warm the heart, warm the mind, and it just reinforces the will to keep on doing the best. Keep on doing the best.
Yes.
Right, excellence is part of the things that
you strive for.
I chase and I strive for. Right, so when we have an option or when we have an avenue to positively impact,
deliver on excellence
in any capacity, it doesn't have to be health. It can be anywhere you are. Take the bull by the horn and positively impact. Just do what you can.
Yeah, that's a word to our guests and our viewers.
Exactly. The call to action is that you make sure to tell one person today, see your dentist, and please floss daily. Make sure you floss. Yeah. Right.
I like that.
So,
I like
thank
that.
You so
you heard that. A call to action is please see your dentist. Make sure you floss daily. Thank you so much, Dr. Iweka, for taking good care of us. Also for making our time to be here in the NIMASA podcast studio.
Well, it was an absolute pleasure.
And of course, for enriching us with very important knowledge on how to best care for our oral health. Our viewers heard you clearly, and I know everybody would be participating on every advice and every advocacy we have given them pertaining to their oral health. Thank you also, I must say, for your service to our dear nation, and of course, to your practical and first-hand contribution to the Nigerian Maritime Administration and Safety Agency. A big shout out to the NIMASA broadcast team, headed by Mr. Kefas Williams, and to everyone creating the magic behind the camera. And so to my viewers, that will be all for today. Thank you for tuning in. Bear in mind, tooth decay is the most common health condition according to the Global Burden of Disease 2019, and oral diseases are largely preventable. You can watch this episode again across all our NIMASA platforms, and please don't forget to subscribe at NIMASA Official. See you right here next time on NIMASA Podcast. That will be all for now. Bye.